Martin, thank you very much for that. Now, it's hoped that a discovery by Scottish scientists could help patients with liver cancer. Researchers from Edinburgh and Glasgow have found a combination of drugs that almost completely eradicated the most common type of the disease. Well, we can hear more about this now from Professor Tom Bird of the University of Edinburgh, who led the study, and we're also joined by John O'Donnell, who was diagnosed with liver cancer 2.5 years ago. Afternoon to both of you.
Good afternoon.
Hi there. Tom, let me just ask you first of all about this particular study and tell us more about what could be a major breakthrough.
Well, yeah, we're really excited about this. What we've done is try to pick apart the disease, which at the moment we just treat as one disease, unlike other forms of cancer. And what we know is that when we treat many patients with chemotherapy, most don't respond, and only a very small proportion have what you or I would consider a good response to chemotherapy. So what we've done is create a whole series of models, avatars, if you like, based on individual patients and how the kind of mutations that form their cancer. And once we've been able to do that, we've been able to, as we think, divide the disease up into a number of forms of subtypes, and from there we can then look at, as proof of principle, whether one form of the disease we can actually use drugs that we already use in the clinic for other things can actually be effective. And what we found is that if you take a drug that's used in other forms of cancer and combine it with the kind of drugs that patients are already getting for liver cancer, it's actually spectacularly effective in the preclinical models. Now, we don't yet know if that will translate into patient responses, but you'll hear from John about his response in clinical trials, and we're really hopeful that this will pave the way for much more personalized medicine, which will improve outcomes for patients.
Yeah. Okay, so this is really about just, looking at a combination of drugs, even if they don't have a specific known use for, in this case, treating liver cancer. Is it just that idea where you try and combine different things and see what happens?
Well, it's more sophisticated than that. We're talking about drugs that are used in other forms of cancer, so we can apply them quite quickly in a clinical trial. But we're using them then in combination with drugs that slow cancers down, but don't necessarily give you a really good response. And what we're seeing in the models, at least, is that does give you a really good response. So we hope not only for this select subtype we're talking about now, but also in the longer term, we might be able to really make big impacts, not only on slowing tumours, but actually maybe even stopping them for patients, which would be a real breakthrough.
Okay, well, John, let me bring you in. You took part in a similar study, but you were diagnosed about 2.5 years ago, I believe. What was that like for you at the time when you heard the news?
I was devastated. The GP more or less told me just to get my affairs into order.
My goodness, what was no other, positive message or idea of hope at all?
No hope at all. She passed me on to Dr. Lenihan at Glasgow Royal, who's a liver specialist, and I went to see him, and he said they would try chemotherapy. He wasn't that confident, but he then spoke to Professor Evans at the Beatson, who contacted me and asked me to go and see him. And from that, I was selected to take part in this liver cancer trial, which has been wonderful.
So how's that gone for you then?
Well, in the first couple of months, my tumour, which was 8.5 centimetres, which is apparently very big, reduced by 35% just in a few months. But then it slowed down, and over the next year, it reduced to 50%, less than 50%, and it stopped at that. It's not growing. But there's no activity in the liver the tumour, as far as I can understand. I'm not getting any treatment now. I'm just being monitored on a 4-weekly basis.
That's incredible, isn't it?
Yes, it is.
And oh gosh, so you're monitored on a 4-weekly basis. And so I take it, obviously, that trial seems to have worked incredibly well for you. Is it something that you would encourage other patients to take part in?
I understand other patients are having excellent results as well. Obviously, not everybody can tolerate the regime.
Okay.
But no, I would highly recommend. But let's face it, I mean, I didn't have any choice. Mm-hmm. But it's been wonderful. The care I've had at the Beatson has been out of this world.
And what does life hold for you now, John? Are you making plans?
Yeah, well, we're off to Germany in a couple of months to visit our old friends. And then we're planning for a long trip to France, about 6 weeks, probably about August, September time. But we got away a lot. I mean, I think we've got a motorhome. We had a motorhome, and we typically go away about 100 days a year.
Lucky you.
We're retired.
Well, you might as well enjoy it. Well, that's fantastic. I'm so pleased the outcome has been so good for you, John. And Tom, I mean, it's heartwarming to hear of John's success in a trial like that. I'm sure it doesn't always work out for everyone, but it does, I suppose, give hope that the more research is done, the more trials are carried out, that the more successful treatments can be discovered.
No, absolutely. And I would highlight we're probably a decade or two behind in our understanding for liver cancer compared to other cancer types like colorectal or breast cancer. But with the research we're doing in Scotland and with the support of CR UK and the Wellcome Trust that funded us, we're really making inroads into that. And so I really hope and expect actually that we will start to make big impacts for many more patients than just John in looking forward, which is really exciting to me. I'm really proud to be part of that.
Fantastic. Well, all the best with it. And thank you both very much indeed for joining me. That's Professor Tom Bird of the University of Edinburgh and John O'Donnell. Many thanks.